Hi, everyone, and welcome to our show, Dee Dee Talks, the Art of Specialty Lenses. I'm your host, Dee Dee Reyes, and today I'm very excited to have Dr. Ed Bennett with us. Ed, introduce yourself and tell everybody about you and about who you are.
Well, thank you, Dee. I'm excited to be here. I'm a professor emeritus at Umson's College of Optometry. I still teach I'm executive director of the GP Lens Institute. I'm chair of the task force on leadership for the American Academy of Optometry. And in a past life, I chaired the Academy section on cornea contact lenses and refractive technologies and AOA's contact lens and cornea section. So it's exciting to still be involved for a chronologically mature educator.
Well, and I'm sure that everybody in the industry that's anybody knows exactly who you are, but I want to thank you for joining us today. And we kind of tie things together a little bit differently. One of the things that we're going to do is kind of ask you some questions about how you feel about gas perms in the industry itself. And then we're going to kind of tie in some of your special talents that I know that you have, not only for technical writing, which is something that I appreciate because I've learned so much from you, but there's some other little keys that I'm not sure that everybody knows about you. So first of all, let's get started with the questions. And so for you, how do you feel gas perm lenses are best utilized in the industry, and how do you see that changing in the future?
I really feel, Dee, that especially gas permeable lenses really aren't a niche product. I really think they're essential to eye care practice. I think they need to be mainstream in practices. And if you look at the last several years, GP lenses have been stable in the market. Scleral lenses are a big reason for that. We all know they're increasing. Spherical corneal GPs are decreasing. But today you have to look at it optimistically, not only with the advancements in scleral lenses, but we're in the early stages of an enormous shift toward myopia control. And certainly orthokeratology is going to play a big role in that. We're seeing advancements in manufacturing such that corneal GPs have better initial comfort, and that opens the door for bitorics, multifocals, corneal lenses for keratoconic patients. And that opens the door real wide for empirical fitting. Mm-hmm. So today we can empirically fit almost all lenses, in some cases not sclerals, in some cases not keratoconics, everything else, ortho-K, bitorics, multifocals, all these we can fit empirically. And that means their first experience visually is a wow factor. And because of that and the quality of manufacturing that we have today, it's really become a situation where patients don't feel the initial awareness as much as they did in a past life. So we see all those advancements. I think today we're seeing as primarily a result of sclerals, but the need for corneal transplants has gone down dramatically. It used to be around 15% of all keratoconics. Today, with that in corneal cross-linking, I wouldn't be surprised if it certainly was less than 5% and going down. So that bodes very, very well. And finally, today we look at the material technology, and we have recently introduced a few really state-of-the-art hyper DK, greater than 150 DK materials. They can be coated, as you know, with the tangible hydropeg coating, but even better yet today with the boost renewable coating that patients can do every month. And we're going to be back to the good old days when we could wear these lenses for several years. So I think we're in a really good place. And I think it's very important for people to understand that GPs should be a very important part of their practice.
And I agree with you. And I think, even in the average practice, not just a specialty practice. And I know in some of the optometrists and offices out there, they're afraid of GP lenses. I see that a lot of times when I'm working with employees or students, that they're just afraid to get started. But once they get started, it's a lot of fun, and it really does help build the business. So how do you feel like specialty lenses are going to grow in the future? And maybe with ortho-K, but how do you feel it's going to grow in the future?
I really think you hit the nail right on the head, Dee, when you talk about the fear factor that people have out there. And that's where our efforts are targeted. It's toward the younger practitioners. It's really toward trying to enhance the confidence of young people. I think we have a number of areas that are positive. You just addressed one with a larger number of our industry partners interested in myopia control. This is going to grow significantly, and both custom soft lenses and orthokeratology will play an important role. Just the number of labs that have recently embraced orthokeratology bodes well for the future of this modality. But we've also benefited greatly, and to address your point about the fear factor, with the large increase and continued interest in cornea and contact lens residencies. These young eye care practitioners truly embrace specialty contact lenses, and they're taking that into specialty practice. They're taking that into schools of optometry, where we have a very nice blend of established educators who are there with corneal GPs and have that passion, now with young people who really have a passion for all specialty lenses. And I think we're just going to see that grow, and that's going to be very, very important. We saw it a few weeks ago when we had the residence meeting at the Illinois College of Optometry. 4 great residency trained educators running the contact lens program at ICO, led by Jennifer Harthens and Lindsay Six, Stephanie Fromstein, and Michelle Mann. And at our own school at UMSL, we've hired Jessica Tu and Carl Kramer. But as a corollary to that, and the GP Lens Institute is working on a project that really was started with the AOA contact lens and cornea section, and that's the intent of significantly increasing the number of contact lens specialty externships at the colleges of optometry. You know, you can look at it this way: you can increase the number of externships by 50, and these are usually like 12-week externships in their 4th year, and you have 4 students per site. That's 200 students who will be getting a great specialty contact lens clinical experience that didn't get it before, and that will significantly change the prescribing habits in clinical practice today. But of course, we're also seeing where scleral lenses will play an important role and continue to do so. We do our readership poll every year. It'll be out in October in Contact Lens Spectrum, looking at prescribing habits. And for the last several years, sclerals have been the go-to lens in a regular cornea for the readership of Contact Lens Spectrum. But I think we're going to see a dramatic increase in scleral use in dry eye disease. We're beginning to see it now. People are beginning to figure out that this is the modality to use that will increase the quality of life for these patients. So I think the future is exciting in that way.
Do you think we're going to see more and more larger lenses for dry eye?
Yes, I think it's something we knew that years ago, didn't we? Even with the Boston prosthetic lens, and it's trickling into practices, and we know all the real big name scleral lens fitters really are dry eye people as well. I mean, they have a big interest in dry eye, so that helps us out tremendously. And I think it's literally beginning to resonate. Like we've got all these practitioners now beginning to go, gee, I better fit sclerals. And of course, now, you know, in the next few years, it's, God, I better use lenses for myopia control. So that's really exciting. And now it's the next step is, gosh, I think I can use these for my dry eye patients because I'm hearing that from everybody that I should. And so we'll see a situation. I think Greg Denayer said it could go up to as much as 30% or so of scleral lens use will be for the dry eye patient.
Oh, well, yeah, that I hadn't heard, but I can believe it. I mean, especially sitting where I am on the consultation side, we are seeing more and more being used for dry eye. So I do absolutely agree with you. So how do you feel that your passion for education has helped impact the students to be better optometrists?
Oh, good question. You know, I'm so lucky, Dee Dee. My life is built around a lot of lucky breaks. And I, like so many people coming out of school, I was headed to private practice. I interviewed with a practice in Indianapolis. It's a great contact lens practice. And if they would have paid anything, I would have never been in education, but they didn't. And so, in fact, they never did find anybody. And the gentleman passed away not long afterwards. But I was doing contact lens research at IU for Drs. Sony and Borish, and they ended up offering me a position. And that is very similar to my professional partner, Benita Henry. She was, kind of came into our first resident at the optometry school. And then that led to her by accident going into education, thank God, for our school. But it's been a privilege to teach students, and I'm still teaching, and I enjoy it more now than I ever have. what you learn over time as a teacher, and this would fall into the category if I knew, then what I know now.
What I know now.
Yeah. Every interaction with a student is a teaching opportunity. If you're in clinic, quiz them in a very constructive manner. Have them, go home and look some things up. Go to the internet sites that have resources, and whether it's the scleral lens or the GPLI or ABB or labs or anywhere where you can find the answers. Do that. That's how I got hooked. Like my mentor would say, go in the library, look up articles, and next thing you know, you're doing that at night. And so those are the best educators. And that's what ultimately I really tried to be, is just be passionate. I think it's really, really important to be positive with students. You really need to, we're all 10 years old. We all like to be complimented. We like people to be positive with us. We'll jump higher, and farther. And that's really important. And welcome and compliment questions. That's where the learning happens. There's no dumb questions. And I love to quiz students, but I'm always thanking them for asking the questions, and whether their answer is right or wrong, it's right. And so, you're really, because everybody else is listening, so you want them to ask questions as well. And I think that's really, really important. We have the GPLI has the residency program, as you know, and one of our programs is how to be an effective clinical mentor. Yeah. And that I think is just something you learn with time. But my teaching methods sometimes are a little unorthodox. I like to do a lot of, today we use a lot of, we call it the Socratic method, but it's cell phone response systems. And so we can quiz students, and that's great. But I like to dress up as different people, and I'll interview that person. It might be Leonardo da Vinci about the history. It might be a female non-compliant patient that I'm interviewing. That's actually me. A vendor of illegal contact lenses, and in fact, the entire Doe family. I do a Doe family lecture, and I'm Jane, I'm John, and they're all. It's right before boards, so it's keratoconic patients, bitorics, multifocals, and all these. The funny thing about this is I originally filmed these about 10 years ago, and I portrayed John Doe as a certain financial gentleman who was starring in a TV show called The Apprentice, and not knowing, that Donald Trump's life was going to, really come out in the forefront more so. But all I remember is he fired me as his optometrist during that interaction. But, so those types of things you do because you do have a passion, and you really want them to be engaged. And that's, for me, that's always important. That I know in 2021, I really do. I enjoy teaching more today than I ever have.
Well, and I think too that those same concepts go back to doctors that are in practice working with their staff members and creating that passion within their staff members for specialty fitting to help get them engaged in things as well, and with their patients. I really think that that's all part of it, to be a good clinician as well.
That's very true. And what I see, and I see it at all the schools today. And again, a lot of it's because of the contact lens residency educated faculty. But we're seeing so many workshops, so much extra clinical training that the schools and the educators are doing. And I think that's so wonderful that the students get that experience to fit all these different types of specialty lenses. And that pays off. I think it really pays off. And I think that it shows that we have a lot of great young educators who really want their students to learn.
Agreed. Absolutely. So what would you say to a brand new optometrist that's just finishing school and wants to get out into the real world with specialty lenses? What's your parting words for them? My parting words to them is that they truly understand that specialty contact lenses are an essential part of optometric practice and a significant profit center for anybody who is in eye care practice. And therefore, it's really important for them to embrace it and to fit all types of lenses. The treatment of ocular disease is fascinating. And of course, that is something that should be learned and implemented. But when you talk about how you can best help your patient and your practice,
it's by fitting specialty contact lenses. Every presbyope should be asked if they're interested in contact lenses, and fit them, as well as high astigmats, keratoconics, and young progressive myopes, and you'll be their hero. That is a critical one. And I truly love students and young eye care practitioners who truly strive to do what's best for each individual patient. I always use my wife as a good example. She owns a private practice. She loves ocular disease, the diagnosis and treatment, but she fits a large number of GP and soft multifocals, bitoric GPs, corneal keratoconic designs, sclerals. And she regularly receives the feedback that, that she has improved the quality of life of these patients. It's one of the great incentives when you look at each individual patient in your practice and you want to do what's best for them. And that's a real key factor. If they're young enough in their education still, Dee Dee, I'll ask them, I would tell them, make sure your clinical sites emphasize contact lenses. If they're beyond that point and they're, like you said, they're getting ready to come out, they're going into practice, consider a residency. That's, you're only young once. I think that's a great idea. But also use your labs and use your laboratory consultants. They're worth their weight in gold. Immediately talk to your consultants. You can start by talking to your contact lens faculty and get ideas about their recommendations on resources and laboratories. But then as you're going out of school, contact the laboratory consultants, get to know them. There's no dumb questions, and start from beginning to what lens design should I use, all the way to fitting, problem solving. They'll take you every step of the way. And the bottom line is, you've just helped a patient improve the quality of their life. You've helped them become successful. And that's, to me, that's a huge part of the formula if you're going to be successful as you get out. And watch webinars. You're young, watch the webinars, and it can be GPLI, Scleral Lens Education Society, your laboratory webinars.
Right.
But those are great educational ones. One I'm going to mention specifically because I think it's the best one I've ever seen, and I'm biased because he's from St. Louis. But every year for many years, every school and college of optometry would bring David Seibel in to do a lecture called "Finding the Practice of Your Dreams." And ultimately he cut back just because of his own time, but we would bring him into UMSL to do it. And then finally GPLI, we filmed it as a webinar, and it was, I'm trying to think when it was last year. And it was, I think, during COVID. So it was probably around May or June of last year. And it's archived under residents and students on the gpli.info site, but it's finding the practice of your dreams. And it's really what you need to do as you're going into practice. And yes, a practice that may emphasize contact lenses, but just, what are the pearls that you need to do to find that practice that you really want to go into, and how to be successful at it when you do. So these factors, I think when you're looking at how I'm coming out of school and what can I do, you have all these resources available. Exactly. The organizations, the webinars, you have residencies, you have faculty. Use them, use them extensively, and you'll be on your way to success.
And you touched on something a few minutes ago that nobody's touched on any of our conversations before, and I'd like you to kind of step into that a little bit, and that's the profitability of specialty lenses in a practice. Because I think that a lot of practitioners don't understand the profitability that's there with specialty lenses. So can you touch on that for just a minute?
Yeah, it's interesting because that's a really key important point for everybody to know. And then the study that was done overseas, I believe in England several years ago, that found that practices that fit contact lenses were 50% more profitable than ones that didn't, is a real important, is really valid study and a really important result. But we've also found there's been some nice studies done again overseas and in England to show that if you're proactive in recommending contact lenses to patients, like if they come in and they're told we fit contact lenses by staff and doctor, you're going to end up being much more profitable especially with the presbyopic patients.
Exactly.
And if you don't do that, so it's when you graduate, for example, from optometry school today, you're typically between $100,000 and $200,000 in debt.
Right.
So, that's really a challenge. And that's really where we need to emphasize the profitability. Contact lenses are a huge profit center for practice, and they're as big a profit center as you want it to be, but it's going to be a much bigger profit center if you fit specialty lenses. You're not going to get the profit on the daily disposables, on the lenses that have a very little market, and ones where they can go to alternative distribution sites to get them.
Agreed.
Boy, you fit sclerals, and you fit keratoconics and presbyopes. Huge opportunity. You can build your practice just by fitting presbyopes.
And that was the point I was going to make. Presbyopia is such a huge space for contact lens professionals that I think it's just, we barely hit the tip of the iceberg on that. Yeah. And again, we're starting to that with myopia management as well.
Yeah, I agree. And it's going to be fun to see in the next 5 years what's going to happen. And myopia management is going to be a big part of that. And I think as it goes to the consumer and they go to the practitioner, and the practitioners have to be ready. And I think that's we're really driving that right now. And it's going to be fun to see what happens.
Yeah, it's going to be a fun industry especially the next 20 years.
I'll tell you a quick story. I remember Brian Holden several years ago, right before he passed away, at Global Specialty Lens Symposium, which is also a great opportunity for young people if they want to learn contact lenses. Go to DSLS in January. But I'm sitting in the front row, and he's telling everybody, if you don't, if you're a high myope and you're 60 years of age or older, you're going to have some form of eye disease. And I'm sitting there going, well, I'm a high myope and I was over 60 and I'm fine. And I think within 6 months, I was diagnosed with glaucoma and I had a posterior vitreal detachment. So he's right. You don't want that to happen to people later in life. You want to be able to intercede and be able to result in a much less shift in myopia. And when that happens, you've really done that person a great favor.
Yeah, I absolutely agree with you. That's fantastic. All right, now I want to shift gears a little bit. I know that you have done many, many technical writing pieces that have influenced me in my career and many optometrists in their careers and many contact lens fitters. So I just want to touch on some of the books that you've done. One is Rigid Gas Permeable Contact Lenses, and then the Contact Lens Problem Solving Guide, which is kind of my Bible, if lack of anything else. So can you just tell us a little bit about your technical writing and the talent that you have for that, and how to encourage that in others?
Oh, I think what I always tell people, Dee, is if I can do it, you can do it. I'm the definition of mediocrity. So if I can do it, you can do it. And a lot of it's just doing it. Once you start writing and you get your name in print, and I'm associated with Contact Lens Spectrum, and I tell that to the residents all the time. I said, try to get involved with that. And once you see your name in print, it's magical. And then you're really, it's a great incentive to continue. And I was not much out of school, and I had the idea for the Rigid Gas Permeable Contact Lens book, and it got rejected by everybody. It was my friend Bob Growy and I, and one letter said, well, we don't know you and we don't think the topic's that great. So, I happened to say, I still have that letter. And then I got Dr. Irvin Borish to agree to author a chapter, and I sent it to his publisher with his name on a chapter, and his book was the biggest selling book in optometry, and then it got published, and that changed my world. And the other books, I'm really proud of. I've worked with such wonderful people, not only Bob, but Barry Weissman. Our clinical contact lens practice book was the one we did a couple editions of, and I was so proud of that. And Barry is just an amazing individual, and how blessed was I to work with him. And then to do 5 editions of our clinical manual of contact lenses with Vanita Henry, who's a close friend and my professional partner, I guess. That's all been fun, and we've had great people contributing chapters. We just had such amazing people who have really contributed to the education of others. So it just all starts with just writing something, a case report. for the Academy Journal or something for Contact Lens Spectrum or Review of Optometry. And then once you see that happens, and it can really take off. And it's a lot of fun. It's a nice adjunct to eye care practice.
Yeah, once you get over the fear factor.
Yeah. Well, you get a lot of red ink along the way, you know.
Yeah.
It's, where you see, and that's the other thing is I've had papers come back, and there's a lot of changes on them, and there's a little bit of that ego in you going, and then but that gets overcome by the fact that you want it to be the best paper possible, and these people are helping you, and that's another reason you write your case reports for the Academy for fellowship, and maybe even for a diplomate. And there'll be changes on those. The more you write, whether it's case reports, however you get it, the more the better you become. And then the more motivated you are to write for publication. And boy, once you do that, and we need more people out there. We know we have a lot of really good young clinicians who really know it. And we just want you to write and get that going. And then, we'll all benefit from it.
Exactly. So, and two, I mean, you're a man of many, many talents, although you don't admit to many of them, but I understand you have a 50th class reunion coming up. You want to tell us a little bit about that?
Yeah, in a couple of weeks. Boy, I'm helping to chair our 50th high school reunion and in charge of the program. And so we've got a lot of neat things going on, but I know that we need to have some type of skit. So we were the Honey Creek Honeybees, which Ashley put the fear into nobody. So I do have a honeybee costume, and I am going to ultimately put that on and buzz the crowd. And some of the one-liners, I'll sit in a few people's laps, and some of the one-liners I'm going to use, I can't tell to your audience, but I'm hoping that everybody will have a lot of fun and we'll have a good time.
Well, and I can relate because I was a high school mascot when I was in high school, so I can absolutely relate to it. All right. I just wanted to thank you so much for being here today, Ed. I just adore you, and I think you're a fantastic educator, and I just think you're one of the most wonderful men I've ever met and an inspiration to me, and I know to many others as well. So thank you so much for being here with us today.
Well, thanks for having me, Dee Dee. It was quite a thrill, and you had so much fun talking to you, and I wish you all the best.
Thank you very much. If you'd like to see further broadcasts, both future and past, please log on to our website at abboptical.com under professional resources /DD Talks. And stay tuned for future episodes of DD Talks, where we sculpt together the art of specialty lenses and art. Thank you to ABB and our guests for being here, and thanks ABB for your support.